The Pan American Health Organization, PAHO, says coronavirus vaccines are safe for pregnant women after their first trimester and mothers who are breastfeeding. PAHO Director Dr. Carissa Etienne addressed the matter at a recent virtual press brief.
There have been concerns about the effect that the coronavirus vaccines can have on pregnant women. Many pharmaceutical companies refrain from confirming its use by pregnant women, citing insufficient data. But that view has changed. On Wednesday, PAHO Director Dr. Carissa Etienne said that the COVID-19 vaccines are critical tools for safeguarding expectant and lactating mothers during the pandemic.
Countries should also give pregnant women and lactating mothers priority for COVID vaccinations. While some countries are already vaccinating pregnant women, less than half of countries in Latin America and the Caribbean have rolled out guidelines to vaccinate this population. So let me be clear. PAHO recommends that all pregnant women after their first trimester, as well as those who are breastfeeding, receive the COVID-19 vaccine. As a mother breastfeeds, she passes immunity to her baby. So COVID-19 vaccines can also help protect newborns from the virus.
She notes some of the health issues that can occur if a pregnant woman contracts COVID-19.
Pregnancy is a particularly vulnerable time. Women's immune systems change during pregnancy, leaving them at higher risk of respiratory infections like COVID-19. We know that if pregnant women become infected, they have a higher risk of developing serious COVID symptoms and more frequently require ventilation and intensive care as compared to women who are not pregnant. They also have a higher chance of delivering their baby early or prematurely.
She also explains that they have a greater chance of experiencing premature delivery. In addition to the vaccines, the PAHO Director said it's also imperative that countries maintain access to healthcare services that are critical to keeping pregnant women on track for safe births, including routine screenings.
At least 40% of the countries in our region have reported disruptions to maternal and newborn care. And these disruptions have become more widespread during this second year of the pandemic. Some countries like Belize and Guatemala report that pregnancy-related care has been disrupted in over half of health sites. This means that far too many women had trouble getting a doctor's appointment at a time when care couldn't be more critical. So far, more than 270,000 pregnant women have become sick with COVID in the Americas, and more than 2,600 of them, or 1% of those infected, have died from the virus. Most countries in our region have already reported more cases and deaths among pregnant women this year than in all of 2020.
Melvin Pennant, PBCJ News.